Hello friends. So in this video we'll understand the physiology and pathogenesis of fever, differentiate it from hypothermia and discuss its clinical significance in medical practice. So let's begin. So fever, normal temperature range which Harrison has got is 36.5 to 37.5 degrees Celsius or 97.7 to 99.5 degree Fahrenheit. So, whenever we have fever, maybe due to bacterial infection, viral infection, fungal infection, so these are exogenous pathogens which will lead to release of cytokines. Three cytokines we have: interleukin 1 beta, TNF alpha, and interleukin 6. These are called endogenous pathogens. So these will go to circumventricular organ, that is organum vasculosum of lamina terminalis, which lacks blood-brain barrier. So these three cytokines can easily go there to the circumventricular organ, and what it will do, it will induce COX-2 enzyme. COX-2 enzyme, as you know, it releases PGE2. So PGE2, what it will do, it will raise hypothalamic set point. See, in normal physiology, if we have 36 in hypothalamus, we have core body temperature as 36 only. But if it increases to 38, what our body tries to do is, by somehow it will increase core body temperature to 38 only, which we perceive as fever. So whenever hypothalamic set point raises, all shunting of blood from peripheral to vital organs to prevent heat loss from skin. So person feels extreme cold. What there will be? There will be shivering, peripheral vasoconstriction, and increased metabolism. So it will increase in core body temperature, and that we perceive as fever. Now you give paracetamol 650 mg to that person. What antipyretic paracetamol does is, it will decrease PGE2. So it will decrease the hypothalamic set point again to from 38 to 36. So our core body temperature will go down from 38 to 36 and fever resolves. So this was physiology of fever. So fever is regulated. It is very much regulated. Whatever hypothalamus does, our body does. If it increases, hypothalamus increases to 38, our body temperature increases to 38. If I give paracetamol to hypothalamus, it will decrease again to 36 or 37. Our body will also decrease. So it is regulated due to upward resetting of hypothalamic set point mediated by cytokines, as you know, interleukin 1-6, TNF alpha, and PGE2. But what is hyperthermia? So hyperthermia is unregulated. Suppose my hypothalamus is 37 only. My hypothalamus is 37 only, but my body temperature rose to 41 degrees Celsius, and hypothalamus is not doing anything. It is 37 only and body temperature is 41. So it is unregulated rise in body temperature where hypothalamic set point is normal but heat production exceeds heat dissipation. What our body continuously doing? It is producing X amount of heat in the body and it is losing also X amount of heat. But if it is losing more, if it production is more than heat loss, then there will be hyperthermia. Why we have to differentiate? If patient comes to you at 41 degrees Celsius, it can be fever due to infection or it can be hyperthermia. You have to recognize that very quickly, because hyperthermia, rapid cooling is required, otherwise it will be very fatal to the other vital organs. So in hyperthermia, you will see patient is very hot but dry. Sweating will be absent in hyperthermia and there will be exertion. Patient might be working in very hot, warm environment and with strenuous exercise, as it happens in heat stroke. Or hyperthermia can happen in malignant hyperthermia. In malignant hyperthermia, there is uncontrolled skeletal muscle hypermetabolism from excessive intracellular calcium release, which can be due to exposure to halothane or succinylcholine. So hypothalamic set point is normal only, it is sitting at 37 degrees Celsius, but because skeletal muscle is so much working, that body core temperature rose to 41 degrees Celsius. Now neuroleptic malignant syndrome, it has severe muscle rigidity. Okay, Neuroleptic malignant syndrome generally occurs due to antipsychotics or sudden withdrawal of dopaminergic drugs. What dopamine does to hypothalamus? It prevents heat dissipation. Okay. Then thyroid storm, of course, due to hypermetabolism, there will be increase in temperature, core body temperature, and severe exertion. Now there can be relative bradycardia. Okay, generally when fever rises by 1 degree Celsius, pulse rate should rise by 10 degrees. 10 degrees. If it is not happening, that is relative bradycardia, which happens in typhoid, leptospira, brucella, drug-induced fever, and factitious fever. Now there are some recurrent fever which Harrison has got: Still disease, familial Mediterranean fever, and hyper IgD syndrome. Now in these, antipyretics are not that much beneficial, so you give interleukin 1 blocker, that is anakinra or canakinumab. So fever and hyperthermia, you have to know how to differentiate. And okay, this is all. Thank you.